Hello and welcome to another episode of Transforming WHO, a series of video interviews where I talk to colleagues in and outside of WHO about the work we do and how we transform. And today I'm very happy to be joined here in this temporary studio that we have set up in the corridors of the World Health Assembly going on here in Geneva. I'm joined by my very good friend, the Regional Director for WHO Europe, Hans Kluge. And welcome, Hans, and thank you for joining me here in the studio.
Thank you.
Welcome to you, Hans.
Thank you, dear sir. Thank you so much.
And happy for taking the time to do this.
Sure.
I know everybody's busy during the Health Assembly. First, a little bit about yourself, Hans. I mean, you have more than 3 decades working in public health and global health. Originally, you started working as a family doctor in your native country of Belgium for a couple of years, but then you were posted the first couple of years by MSF, several African countries, Liberia, Somalia, working very much on tuberculosis, TB, then also Russian Federation, Siberia, working with TB in prisons. And then you shifted, I believe, some 25 years ago to WHO. Worked in a number of country offices, including Russian Federation, Myanmar, again, TB, communicable diseases. And then, I believe, roughly 15 years ago, you joined the regional office for Europe.
Jumped to health systems.
And then it was health systems. And that's where I met you, working on that and in the European region. And then you were elected regional director in your first term. You started January 2020. I remember that. You were, of course, elected by the EB in January 2020. And then you had a few weeks to settle in. And then the pandemic hit. And that's sort of been, now you're just started your second term as regional director. You were re-elected here in January, and now there's another crisis of funding to WHO. So it seems like there's been many crises during your term in office. There's also an ongoing war in Europe that you've been quite involved in the humanitarian.
My wife says, sir, each time I start a mandate, a crisis breaks out. Whether it's a cause or relation, I don't know, but we have to be careful optimists to tackle those.
I think it reflects the world we live in, don't you think?
Absolutely,
absolutely. Any lessons learned from leading now for 5 years through the European region, through crisis? Any lessons learned from leadership and crisis?
Yes, it's a very complicated job, Søren, but it's also a magnificent job. Of course, as a WHO, our counterparts are the countries, the ministries of health. So you don't do, let's say, hands-on job. But what I got to know is that good policy saves lives. For example, if you can convince a country to have a law that bans indoor smoking, I mean, you can save thousands of lives. You can prevent so many children with secondary asthma. So policy is very important. But what I learned is we have to explain to the people what WHO is doing. You know, if you're UNICEF or WFP and you save a child or you give a food, you know, it's very easy to understand. But policy work, you know, is very important, but we need to communicate a little bit better. I think that's a big lesson I learned.
But what we have, no, I agree. And of course, it's complex. I mean, being the normative, technical leading body, I mean, because we basically have everything in health. But the COVID-19 pandemic is a good example because that was a health crisis. I think everybody realized the important role of WHO.
Absolutely.
And in 2020, after, of course, the outbreak in Asia, the epicenter of the pandemic shifted very quickly to Europe. And of course, then there was everybody looked at WHO. You have 53 countries in your region. You serve the 53 countries, but you also support them. Can you speak a little bit about the leadership, the complexity of doing that in the pandemic?
I remember very well, Søren. I think actually we were sitting together. You were the chair of our governing body board when you were called also by Prime Minister, right? And some quick actions had to be done. So we were standing side by side, right? And learned a lot of lessons. So I would say that what's important is hope for the best, but prepare for the worst. And I never thought that my experience with MSF would be so helpful to weather that crisis. So very quickly, we reprofiled the whole office on this crisis, because remember what happened in Italy, but also in Spain, in the UK. So we had to be very, very fast. And with a pandemic, particularly if it's a virus of a unknown origin, speed matters. But what we also learned is that we had to work on dual track, which we did not enough. It means manage the crisis, but not to forget about screening for cancer, giving routine immunization. And I think that's a lesson, something maybe we could have done better to put more attention to the mental health. I saw it from my own daughters that this really had a huge impact. These lockdowns on the youth. Then also, one of my priorities now, our second mandate, is to address violence against women and girls. Can you imagine that you are locked down in your home with your perpetrator? Because the social protective mechanisms, like the schools or the social services, were shut out. So this is something that we're working on because we're going to have more crises, it's sure.
And that is also some of the things we saw. I mean, all countries around the world, but certainly also in the European region. In the pandemic, we saw how the pandemic shone light on the social fractures, the economical fractures in all of our societies. So also the countries in responding, I mean, they did that from a stronger position if they had strong economies and social coherence. And you initiated the so-called Monty Mission, which was chaired by the former Prime Minister of Italy, Mario Monti, exactly to sort of look at the lessons learned. And they came out with a report, I believe, in 2021, with some recommendations on how we could use the lessons learned from the pandemic in strengthening the social and economic cohesion of our societies. That's still valid, I guess.
Yes, I'm very happy you go back to the Monty Commission because Mario Monti was, I always remember, I called him on a Sunday to ask if he could chair the commission and he was telling Dr. Kluge, I'm very honored you called me, but probably you dialed the wrong number because I have no clue about health, he told, because he's a very famous economist and prime minister. But this was the innovation that we needed, especially authorities outside of the health sector. Because we saw that the countries which did best were those where there was an involvement of the whole of society, the whole of the government. Because interesting, they're certain that the people were actually less concerned about the disease or whether they were going to fall sick or even die. They were concerned whether their children would continue to go to the school, whether the caretaker would still have a job. And I think that's what we saw, that where the press conferences were done, like actually in Denmark, not only by the health sector, but with the police, with the social sphere, that people felt taken care of all their needs. That were the countries which did best. So I think that's a big lesson. Health, yes, but not only health.
And how would you say that the countries of the European region, are they in a better place now if there's a new health crisis, or do you still see that the recommendations of the Monty Commission
Søren, every journalist is asking me this question, and I'm a born optimist, so I think that the glass honestly is half full. For example, I think the mentality of the people changed. Previously, you were in an airport, you saw people with a mask, you'll be very surprised. No, it's really different. People are coughing, okay, maybe I have to protect the other one. So the people mentality. The other one, I think a very important one, is that in the European Union there is a new body which is called HERA. It's a body looking at joint procurement. And I just had a meeting with the new Director General to ask that HERA is going to look also to its neighbors, because the EU cannot be safe without its neighbors. So there are a number of big things which happened. I think mental health is taken out of the dark corner. People talk more about burnouts. It's nothing, I always say, it's okay not to be okay.
But that was one of the priorities. I mean, I remember when you started your first term of office, you had these flagship initiatives, and mental health was one of your flagship initiatives. Exactly, I mean, getting rid of the stigma, getting priorities for mental health services.
I think we did a good job there, in all modesty, to have it. I mean, you see it. Every EU presidency, also in the eastern part of the region, it's at the top of the political agenda. I mean, certain 28% of the girls 15-year-old are telling that they feel lonely most of the time or the whole time.
And we saw that actually before the pandemic, but then it was exacerbated by COVID-19 and it's still there. It's like we haven't recovered. And we see it in all regions.
Absolutely.
Actually. It's not a European thing.
No, and we need to really watch this, work on this. We're doing now a regional survey on the impact of social media and screen time on the mental health of the youth. I mean, it's not an exception that you go somewhere and you see two youngsters talking to each other through their phone instead of face to face. So this is a phenomenal shift in society on how do we live together. We need to study this. At the other side, again, positive, you see in many countries, to take one, Kazakhstan, where mental health is being integrated into the primary healthcare. But in many countries, including my own in Belgium, I mean, these waiting times to see a psychiatrist
because
is still
that's
too long,
basically
sir.
speaking to health systems. I know that from my
Yes.
own country. I mean, you
Exactly.
had priority to cancer, NCDs, many different areas, but mental health was always second priority in many societies.
Well, remember, we launched together the 10-year plan in Denmark with 3 ministers, not only health, and congratulations, and now I understand the budget is there, is a big one. So we need this in more countries to get down to, to the people basically, to the communities.
Yeah. And now you're in your second term, and now you're working, of course, with your team in the regional office on the second European program of work, the so-called EPWs. You will convene the regional committee later this year in October, and of course you expect them to adopt the EPW too. Can you speak to some of the priorities that you propose in the new EPW?
Yes, indeed. So this is kind of the next 5-year European health policy and then the program of work. I advocated 80% continuity, 20% of innovation. Because we have to consolidate post-COVID. So in the innovation, again, this is not Hans Kluge's priorities, but you know this, right, sir? We did a very thorough consultation through artificial intelligence. 4 priorities. Number 1 is health security. Because it's amazing. You were talking about the COVID-19, sir. We see that health is already dropping from the political agenda. Money goes to defense. I mean, for Pete's sake, we just came out of the COVID-19. Economies were shut down. No, people died. But still, health is already a little bit forgotten.
Like the human race is like that. It used to be climate, then it was the pandemic, and now it's security,
but
right?
Sir, when I talk to a president or a prime minister and I say, Mr. or Madam President, how can your country be safe without having a stockpile of vaccines and medicines, without doing simulation exercise of your trauma care capacity of your hospitals in case of mass casualty event, then they understand. So health security is our goal. Number 2 is climate change and health. 11 June in Reykjavik, I'm going to launch the Pan-European Commission on Climate Change and Health with previous Prime Minister Katarina Jakobsdottir and 10 very strong commissioners to elevate the health sector leadership in the climate change debate. Number 3 is what I call the silent pandemic of chronic diseases and mental health, because ultimately 9 out of 10 in the world is going to pass away from a stroke, a heart attack. I mean, everyone has something in the family with cancer. I mean, we really need to focus on those issues, and we know what are the risk factors: tobacco, alcohol, lack of physical activity, nutrition. And then the 4th one is a big one, which actually I just came from China, is the same, it's aging. Declining fertility. For the first time in history, we have in the European region more people older than 65 than less than 15 years. The only way
But
is
it's
to
actually a
start prevention.
success story of health systems,
Yes.
which is then flipping to becoming
So,
a potential
actually,
burden on,
aging, this is a good point. I always say aging is not a disease. No, aging is a privilege. It's a gift. If I look to my own parents, I mean, I'm so happy that they're
But
still
it does
there.
challenge our health and care services.
Because we are aging not healthy, sir. And the only way to age in good health is to start at the first 5 years in health and even prenatal, because that determines how we are going to do
So
later
the
on.
4 priorities, and then the 5th one is NCDs, or?
The 5th one is a special initiative. Actually, I have 2 special initiatives. One is the primary healthcare.
Oh, yeah.
Has to be connected. Primary healthcare, sir, is the magic bullet. And this is the bread and butter of WHO. To bring care and prevention close to where people are living. Second initiative, for which I'm overwhelmed by the support of every minister, is to address violence against women and girls. I'm the father of 2 daughters. You know this, right? You know them, Søren. I mean, it scares the hell out of me. 1 out of 4 girls in our region, before they turn 20, is going to have at least one event of intimate partner violence or non-partner sexual violence. Unacceptable. And health sector is the weakest link in the multi-sectoral response, because our healthcare workers are either not aware, don't recognize, or they think it's a police issue and not a health issue.
So these are the priorities of the EPW, or the
Absolutely,
proposal. Of
yes.
course, you expect the member states to
Yes.
agree. I mean, that is perfectly aligned with the GPW, which is the global program of work that was adopted in the Health Assembly last year. So a critical voice, Hans might say, why do you need a EPW when we have the GPW?
Yes, there were a number of questions like this. No, my minister don't ask this question anymore. Number one, because the global program of work, Søren, by definition is generic, because it has to apply to 194 countries. I mean, every region has specificities, right? I mean, Georgia was just declared malaria-free. Malaria is not a big issue in our region. So we have specifics. So it's translating the generic global program to the pan-European context. And number two, because we have to admit it, we are in an existential crisis. WHO, the United States of America, left the organization. So we have to, I wouldn't say prioritize, we have to deprioritize. So it's a very helpful exercise to know what do the ministers really want.
So you're basically using the EPW also for the prioritization in the region.
Exactly.
I was watching, you had these member state consultations already on the first draft of the EPW, positive comments, congratulations. But some of things I noticed was they want a stronger focus on sort of social involvement, civil society,
Social participation.
cross-sectoral social participation, and also trust in science, trust in WHO. So how will that be reflected in the next draft of the EPW?
Yes, spot on, Søren. So actually, I'm quite proud of this. With the first mandate, we established as WHO Euro, the first ones, behavioral and cultural insights team, and now we'll have a specific stream of work on trust, because this is so important. Very interesting, even at the height of the pandemic, when trust in public institutions really dropped, people always kept the trust in the primary healthcare providers, their family doctor, the nurse, the midwife, the social worker. So that's very important. So we have to empower the trusted community messengers and do much more work. But basically, I mean, do what you did, Søren, when there were some issues with the HPV vaccination in Denmark, to study. Don't point the finger at the anti-vaxxers or whatever. We have to talk to them, engage them. I mean, so much fake news on the pandemic treaty, which is a big success, right?
Yeah, that's
All
a good
WHO is
example.
taking away national sovereignty. This is not true.
Yeah.
But we have to explain in people language what it means.
Exactly, yeah. So we're facing a crisis. You already
Absolutely.
addressed that with the intention of the United States government to leave WHO withdrawing funding. But it's bigger than that. I mean, it's also a reduction of developmental assistance from many other countries. We also see that affecting not only WHO, but many of our sister agencies in the multilateral sphere, and also in bilateral funding for global health programs. So it's a broad crisis, but it's about more than funding. It's also a challenge to values, principles, gender equality, equity, principles of science even.
Yes, sexual reproductive health and rights.
Yeah.
Yes.
So is there cause for optimism or cause for concern? Do you see a future of multilateralism?
Yes, I think both concern. I mean, we cannot deny this. We are in an existential crisis. Absolutely true. Every crisis is also an opportunity, Søren. How painful it is. So my approach is back to the basics. WHO, 77 years old, has to go back to its fundamentals, really. This is number one. Number two, I will give a very concrete...
And by fundamentals, you mean our normative technical role,
Absolutely.
our leading
Health
and
security,
convening.
health promotion,
Yeah,
primary healthcare,
yeah,
and very important, something very cheap but very powerful, the convening power. I'm always amazed.
our core mandate.
Exactly.
basically.
That
Yeah.
we can, with our brand, Søren, convene the best minds in the world. And if you put them around the table, you come up with some amazing innovative solutions to the most complex problems. Because we are trusted. And that's why it's very important, Søren, that WHO never chooses side in wars and conflicts. I'm a medical doctor, you're a medical doctor. A patient has to be helped everywhere. In Gaza, in Israel, in Ukraine, in Russia. But we have to stand strong No attacks on healthcare workers and healthcare facilities. A red line. I will give a very concrete example how I still managed to rally all 53 member states on sensitive issues. It's on my special initiative to address violence against women and girls. Every country agrees. And then, if you get them around the table, let's little by little, after we rebuild trust, speak about the more sensitive issues, the gender issues, the LGBTQI+. You know, I'm a great champion on that one. I mean, every individual should be allowed to live, to care with dignity, respect, and to access healthcare without fear.
So if we focus on that core mandate and prioritize our things, you are optimist in this crisis.
I'm optimist, but we're going to face 2 difficult years, sir. Absolutely. So in that sense, we will have to cut the 20% of the budget of the workforce. But through the prioritization exercise, we know what to do. I learned a lot of lessons from UNESCO, who went through this process 15 years ago. And I'm convinced that we will get out stronger. But what is also very important, sir, and I discussed it with Dr. Tedros as well, is the necessity to talk to the United States of America, to explain, and other countries, not only America, no, to other countries, that WHO is not about bureaucracy. It's about boots on the ground in 150 countries. It's about early warning of threats. That a strong WHO means that we help countries, including the United States, to prevent shutting down borders, economies to collapse, and jobs to be killed. That the best way to protect national sovereignty is international collaboration through global health security.
So we basically have to stick to our core mandate, prioritize, and show the added value of WHO.
And be strong on our values.
Yeah.
Never giving on our values of universality and leaving no one behind.
And the principles of science, I might add as well.
Absolutely. Strong science.
Thank you very much, Hans, for joining me here in
My
this
pleasure.
temporary studio. And thank you very much, all of you, for watching yet another episode of Transforming WHO. And do stay tuned on this channel for upcoming episodes.
Yeah!